Hi, all my friends out there in TV land. Good morning, good afternoon, good evening. I know you watch it at different times, and this is Senior Issues, etc. I'm your host, Vita Verdon, and now, you know, I really listen to when you call me and the emails I've gotten and the snail mail, and we are a community service, so we're here to serve you, and I pay attention. And I have had several requests to do a show on this subject. And the subject matter is the pros and cons of knee and hip replacement. Well, I'll tell you, this could take a 6-week seminar, but we boiled it down to like steer you in the right direction. Now, the thought came to me, now what doctor do I use? And bingo, these little gray cells came alive. Why don't I use my doctor? You know, a little more than 10 years ago, I had a fall and my femur was just shattered. So fortunately, I got one of the best doctors around, and you want to know something? I was so fortunate and blessed to get him for today because he is a busy, busy man. So I got you the finest bone doctor that there is in the area, Dr. John Meyer. It's so nice to have you here today, Doctor. And I know that you're a part of an association, the Greeleaf Association, and we're located. So maybe you could tell our audience a little bit about yourself, because they like to get up close and personal.
Sure.
And so they like to know, well, now, who is he, where is he located, and what is he about, and is he married, and you know, everything. Okay.
Well, I grew up in the Chicago area. I attended high school in Chicago. I went to the University of Illinois. I went to Chicago Medical School. I did my residency at Michael Reese Medical Center. And then I did a year of what's called fellowship training, which is subspecializing in joint replacement in Arlington, Virginia. I've been in practice for about 25 years now. I'm currently with a group, Greeleaf Orthopaedic Associates, and we're located in Libertyville and Gurnee in Lake County, Illinois, about 30 miles north of Chicago.
And now, are you married?
I am married.
What's her name?
Her name is Kim.
You know what I want you to do? And I don't want you to give us a puny, I want you to give a, in that camera right there, a big smack to her.
I love you, Kim.
Good, that's good.
I have 3 great children, 26, 24, and 18.
Oh, how nice.
And they're a blessing in my life.
Oh, that is so nice. It's so nice to hear you're a nice family doctor. Now, if you could tell us a little bit about the organization that you are a part of.
Okay. Greeleaf Orthopedics is a group of 4 orthopedic doctors. We all have a little bit special area of interest. Mine is within the realm of joint replacement of the hip and knee. We have another doctor that is specially trained in ankle and foot surgery, an orthopedic doctor. One doctor is in sports medicine. The other doctor does a combination of all.
And I know because I've been in the facility several times, there's also a therapy section.
Yes.
Right? So you have a group of therapists that...
Yes, we have a therapy clinic associated with each of our offices.
Oh, so that's nice to know. In the area of all this orthopedic work, maybe you could explain to our audience what that means.
Okay.
The orthopedics.
Orthopedics in general encompasses bones and joints, typically fractures, which is a common occurrence, injuries to muscles, athletic injuries, in my case, arthritis progression, foot and ankle problems. So muscles, tendons, bones, joints.
So your specialty is mostly hip and knees.
Yes.
Or like accident cases,
yes,
which happened to me.
Hip and knee replacements is about 90% of what I do, and then occasional trauma, fractures, like in your case.
Now, let's start right in, because this seems to be the question that I have gotten is there's so much information that we're getting between the internet and what's on television and everything is there seems to be like fragmentation, so maybe you could address that issue right off the bat.
Okay. I think the issue you're talking about is called wear debris, where small particles, in a sense, over time start to come loose from some of the surfaces. Historically, that's always been a factor in joint replacement, but as a rule is a very small issue in general. It's something that occurs after many years, after a decade or two of wear and tear, where the plastic might wear, where you'd go in and put in a new piece of plastic. The current issue that's gotten a lot of press is metal on metal debris. One of the developments in the joint field, perhaps about 15 years ago, was to try to eliminate the plastic debris and develop metal surfaces, but now it's come out that in some people, they have a higher sensitivity to the metal debris, and as a result, it creates a very dramatic response.
But that's a very small percentage.
Exactly. There were very isolated, specific designs that had a higher percentage of this, and that's what gets all the press on the advertising on TV and the media and everything. But for practical purposes, it's a minimal, negligible part of orthopedics, and certainly is not something that people now need to worry about when they get a new joint replacement.
Well, since you talked about, because this has come across on television, and I want to display the myth that this is such a common thing. It's not a real common thing.
No, it is not.
And what I'd like you to go into just a little bit briefly is that all these things that we see advertised on television, and it gives the impression like this is authentic, it's coming from a doctor's clinic, or this is a doctor that's saying it.
In the last 5 years, we've seen kind of a growth of orthopedic marketing, if you will. Where different
it's called marketing. That's what
where different companies market their specific implants and tout fine-tuning of their design that has advantages over others. But by and large, they're of negligible consequence. There's certainly a half a dozen or a dozen companies that make very good products. They advertise the differences, but by and large, they all have excellent success rate. So not to place too much emphasis on the marketing would be my
not to place too much emphasis on the marketing.
Right. Whether it's implants or whether it's things like approach, surgical approach, certain materials, by and large, they all have a high success rate well into the upper 90s.
Well, now, getting to, we'll start like with the hip, in a hip replacement. Maybe you could tell us, what would it be a warning sign that a person is interested? What is the difference between that or it's just an arthritis attack?
Right. Well, typically arthritis progresses over years rather than months, and common symptoms would include pain and stiffness as far as twisting the hip, difficulty putting on shoes and socks. Typical location for hip arthritis discomfort would be pain in the groin, difficulty walking, difficulty doing stairs, things like that.
Well, I think the question that I'm thinking of is, well, how does the person know, well, this is just something that I have to live with, or I really need a replacement? Because I think that's the question of many people.
Sure, and that isn't necessarily a black or white decision for each individual, correct.
Yes.
But I think seeing an orthopedic doctor, getting an x-ray, he can then correlate what the x-ray shows with how the patient is doing as far as symptoms, how much of an impact it has on the lifestyle, and those are all factors that come to the decision of, is a joint replacement at this time right for you?
Well, I think it's an important measure, and I'm constantly preaching that we can't evaluate ourselves.
True.
And that we really need to investigate that through a professional. So I think that the first step would be everybody has a primary doctor.
Absolutely.
Is to go to a primary doctor, and through the primary doctor, let the primary doctor give a reference to a specialist, and the specialist could go through a series of tests.
Exactly. I think that's sound advice.
Now, on some of these cases, instead of replacement, is there a possibility that a person could increase their exercise or go on some program like losing weight or something that would be beneficial, and then they don't need a replacement?
I wouldn't say it could get to the point of not needing one, but certainly it can ease the symptoms. Certainly losing weight is one. Physical therapy or a regular form of exercise can help maintain movement, limit stiffness, keep the muscles around the joint stronger. That would all help contribute to better function and less misery while you're sustaining the arthritic symptoms.
And now the other thing is, you know, when they just go in with a needle, what do you call that?
Arthroscopic surgery.
Now, what does that do?
Right. Well, arthroscopic surgery would be irrelevant in a knee situation.
In a knee situation.
Where there might be, let's say, a mild to moderate form of arthritis that isn't bad enough to need a joint replacement. Historically, arthroscopic surgery was used to try to clean up the joint and make the symptoms better. Results with that are
They can do that with the needles, where they go around?
You can use small instruments to go inside the joint, clean up some of the fragmented bone or cartilage, smooth out the surfaces as best possible, but they never regain their good capacity for mobility. Right. So it's not always a rewarding procedure.
But if it's necessary, that's something that...
That's an option, certainly, before a replacement.
But all these things need to be investigated, right?
Yes.
So everything in its proper place. See, so if you go through the steps of going to a regular doctor and then having a specialist see you, that you could have a consultation, and then that takes the gray areas away.
Correct.
That the person could be on track. Okay, well, we're going to come back to it, but right now I'm going to do Vita's Pearls of Wisdom. Now, you know that I don't want to focus on my surgery because the request I had was for knee and hip, so I'm trying to keep it in that area. But I did my rehabilitation in a nursing facility at the Winchester House, and before I was released from there, the therapist came into my home, and what we did is we went through every room. Now, you don't need to do this after you come out of surgery. You could do this right today, and it's going to help you prevent a fall. One of the very most important things is see that you have nothing loose on the floor. Like, I don't have any of these little throw rugs in my bathroom because, you know, I could kick it over and I could fall on that. Or in front of your sink, or when you walk in the apartment. So clear up all that area. The next area is check and see if you have any chairs with casters on them at our age, as we're aging, you know, that could be a dangerous situation as you, well, the chair could go out from under you. That's another situation. Another situation is this. You know, these little step stools or even a little tiny stool, well, they have little rubber tips at the bottom, and those rubber tips wear out. Now, that's one of the things that happened to me. I was on this short little step stool. It had about 4 steps on it, and at the bottom, 2 of these had worn off and fallen off, and I hadn't really checked them. So when I went up them, it went out from under me, the step stool, and I went flying across my kitchen to my kitchen floor. So check all the bottoms of your climbing, if you have a step ladder, a little stool, or any kind of step thing. And then the next thing that is a good thing to remember is to use everything, like in your linen closet, in your cabinets, in your kitchen, or in any of your rooms if you have a storage closet, to see that what you're mainly using to function in your everyday living, that it is at a length that is reachable for you, or that if it's hard for you to bend, if you have, I have a plate in my leg, that I don't have everything too low, so that it is measured at a length that you can function in a way. And here is the last one I want to give you that is really important. Make a path from your bed to the bathroom, that there is nothing in the way, that it's a clear path, and that you have a night light there that you'll be able to see, because that is one of the danger zones that you could go through. Now, if you take all these little tips, which don't cost you any money, and it doesn't take that much time, you could prevent in your life the kind of thing that I went through. I'm so happy, you know, like that I had the doctor who's here, because I don't know if I would be able to. I give credit to the doctor and to the nursing home that I was in that helped me with my therapy to walk. I would be in a wheelchair. But for God's grace and these people, you know, I'm walking, you know, without the aid of anything. And with some prevention, remember, I'm always harping this, we are the generation that is living this long, and we have an earnest responsibility to pass on to the next generation, because of technology and the changes in medicine, how to live healthy and live up to a ripe age, and that we could pass that on, because what we're supposed to pass on is some wisdom. Now we're going to get back to the doctor, and what he's going to show us is some of the elements in having hip and knee replacement and how they work. So pay attention.
Okay.
Nicely, I'm saying it with love.
This is an example of a knee replacement. The clear plastic would represent your bone. So essentially there are 4 parts. There's a femur part, and basically we take off 1 centimeter of bone, put on this metal piece. There's a tibial part, which is also metal, that goes inside the tibia bone. There's a piece of plastic that sits between the 2 pieces of metal. And then there's a part typically that goes on the undersurface of the kneecap. And this represents your muscle, your tendon, your ligaments, and when everything is together, it works like that.
That seems to work so good.
Well, and by and large, joint replacement and orthopedic surgery is probably one of the best procedures that you can have, in the sense that it's a very reliable, predictable, very gratifying surgery where vast majority of people do extremely well.
Oh, that's good. It seems so simple when you do it that way, when you show it like that. Okay.
This is an example of a hip replacement. Let me turn it around. So this would represent the thigh bone. We take off the arthritic ball. We make a channel inside the marrow. The hip implant fits inside the channel. We take a hemisphere of a socket, and then this usually would have a plastic liner, and the 2 pieces fit together, and the hip would move like that.
That seems to work so good, too. Okay, let's go through a little recapping now. Now, what advice would you give to a person if they don't actually know, you know, at what stage they're in? Maybe just look in the camera and give them some advice what they should do.
Well, I think the basic guideline that I would convey to patients is when the discomfort or the hip or knee impacts your life to a great enough degree that you have to give up things you enjoy, family activities, social activities, because you're in pain and can't do it. See your doctor, be referred to an orthopedic surgeon. He'll get x-rays, he'll talk to you about your details of your symptoms, and then formulate a plan. And there's other things, again, in the plan before you get to a joint replacement that I think would be worth trying.
What would be the other things in the plan?
Well, certain medications, sometimes injections can be helpful, and those kinds of things.
And so, but there should be a plan that you should follow, that it wouldn't get that bad to
Well, once it gets bad, the early parts of the plan can help ease the symptoms. Often arthritis does get worse over many years to maybe even a decade, but until it gets worse, there are things that can make your life better.
Oh, well, the other question that I'd like to ask is, how long, what is the life of a artificial replacement?
The statistics show that over 90% of people are happy for 15 to 20 years as far as good function.
Well, that's a long
and pain
time.
relief. Very
Now,
much so.
I myself would have guessed like 10 years, but you say it could go as long as 20 years.
Yes. There have been improvements of design, fine-tuning parts of design, improvements of how the plastic is formulated to make it last longer, so all those things are helping.
Now, is the replacement, does it stick to one kind of material, or are there different materials that is used?
The common materials are a chrome cobalt alloy of metal, titanium metal, and a high-density polyethylene.
Now, what I'd like to talk about, say a person has this done, how about, can we talk about the recovery period a little bit?
Sure. After surgery, you'd be in the hospital typically 2 or 3 days. 2 or 3 days. After hospitalization, for most people, depending on age group and general strength, let's say 80s, upper 70s, or if there's no help at home, you'd go to a rehabilitation facility where you'd stay for a week or 2 to build up strength until you're better able to be independent at home.
And then once they're at home, do most people still require a type of therapy?
Yes, and actually, as you had mentioned, therapy often can come to the house and make suggestions of how to move furniture, take away rugs, and that's part of that assessment. And then typically therapy would come to the house 3 times a week. At some point, then they would transition to go to outpatient therapy once they have more independence.
Well, what happened with me is I had... because I had 2 surgeries, so I was in the nursing home about 8 months. Well, I came out for 2 weeks and then went back in for another surgery. Then I had, in my apartment, I had therapy. And what my therapist did is I just had a fear of driving my car. So I had therapy at home, but then she was kind enough to get with me in my car, and we just drove around the parking lot. And after I did this about 3 or 4 times, and then she said, "You're ready, you can have outpatient therapy."
Right, exactly.
So, you know, there isn't a black and white way of doing it. This is one thing I want to stress, because I've gone through this, not with hip and knee, but I've gone through this myself. Every case is different, right, doctor?
Absolutely.
But, you know, I have found that the facilities and the doctors, because it's such a wide range and every case is different, will sort of like design a program for individuals.
Right, and that's very common, whether it's the doctor or the therapist or the nurses that take care of you. You know, hopefully they're all loving, caring people that will adjust to the things that you need specifically that'll help you the most.
And our focus of bringing this information forward is that sometimes when it's an unknown factor, there's so much fear involved, and we want to take the sting out of it, letting you in on the steps of a process that you take the next step in taking care of yourself. You know, I have found that once I have information, you know, it doesn't frighten me as much.
Very true.
So if there's any information, I think that they could call the clinic. They can call your clinic, which we are listed the name on graphics, you know, and I think that they would be directed in the right direction for what they need to get themselves in a healthier state. So I advise for them to do that. Now, I know that how long have you been doing this, doctor?
25 years.
25 years. So you've got some experiences under your belt, right?
Yes.
You've got a pack of experiences. I know recently, just this last week, you did one of our crew members, Sharon Click, you know, and she said that this is what she told the producer and myself. She says, the minute I went in his office and he came in and sat down and said, "Now what can I do for you?" She said, "I knew he was my doctor." You know, so I think that not only having the experience, but having the compassion of that bedside manner, because another one of our crew members, the man that's filming you right now, you did his wife, both of her knees, you know, and so that is really a high recommendation when you find these elements. And I'm not selling this doctor. He doesn't need to be sold. But what I am promoting is that you take care of yourself, because this is what we're doing right now in the community service, is giving you ways, and this is information that you have contacted me on, and hopefully you will follow through with this. Now, as doctor, where does your passion lie, and what led you to get into this line of work?
When I went into medicine, I saw the opportunity that orthopedics is a field where you can fix things and you can make things work.
You're a fixer. See that? He's a fixer.
And I was drawn to joint replacement because it's such a dramatic change in people's lives.
That is a dramatic change.
Where you can really get people back to enjoying life and doing things and being social. And
because, you know, when you lose your mobility, it's like, you know, the aging is a process. I'm in the process myself. I'm 80 years old, and I've learned how can I cope with this and keep up not only my mobility, my dignity, that I could still be a vital person and function, you know, on all the dimensions.
Right.
And that's important because, you know, people say, well, I never heard of this from my mother and father. Yeah, because they died very young.
Well, true.
You know, that's why. And that's why we hear this today. But now, where does your passion lie? What kind of gratification are you getting out of this? You're always seeing all these broken bones.
Yeah. Well, I guess I personally feel that I live every day by the grace of God. And it's a joy for me taking care of people, especially just being able to restore their lives and make such a contribution. That's what keeps me going.
That is a good thing. Now, this show, you know, will be seen. It's seen in Lake County, it's seen in Vernon Hills, and it's seen in Evanston. But we also go up on YouTube and Patch. So you can look it up if you want to have this saved for your library. What you can do is go into Senior Issues, etc. is ETC. You don't have to spell the whole word out. .org. And then on the website, you just scroll down, and within a couple of weeks of this show being filmed, it will go up on YouTube and you could press the link, press the button for the link, or you can press the button for the blog, and it will show you. And so what we'd like to do is if there's any changes that occur with different models, to have you on periodically, you know, so that we can keep this update, because it seems to be so forefront in the society we're living with today. And if you could give one word of advice to our audience out there, what would you say to them?
Oh, just, you know, feel free to get different opinions from different doctors. Find someone that you're comfortable with. Don't be afraid to be evaluated. You're not obligated to proceed with any surgery that you're not comfortable with. But there are lots of opportunities to help make your life better, even short of surgery. So don't be afraid to take that first step.
And this one's for you. You know what time it is now? When you out there, I'm talking to all of you out there, come to the end of your rope. You know what you do? You tie a knot and hang on. And you know why? Because the best is yet to come. And you have to learn how to live that way. And what we want you all to do this week is catch the spirit. God bless you. We love you.